Hey everyone, Dr. Brian here, and today we've got a video. In this video, we're going to talk about some of the testing that Dr. Schmo does, and also about the therapy that Dr. Schmo does in detail about how he comes up with some of the treatments and just what therapy is like at the FNC. So to start, what I want to do is I want to go over the whole intake process again. I think one of the videos, one of the other doctors might have talked about this, but just for reference, patients that come in, first thing they do is they'll get testing done. And there's sort of two categories to the types of testing that we do. One of them is more of the bedside exam or the neurological exam, which I'll talk about in a different video coming up this week. And that's more Dr. Mo comes in and he'll manually test different areas, or he'll do more physical testing, if you will, sensory, motor testing, different challenges and things like that. And that's a good chunk. That's an important test of what you can see at the bedside. The other category of testing, though, is more diagnostic, meaning things that have graphs, things that have data, things like that. Not anyone's opinion, just more of you do something and this is what it looks like. Dr. Mo has different types of diagnostic testing. There's different types of balance. There's different types of eye movement testing. One of them being the VNG, where you put these black goggles on and you do different eye movements, and it video records your eyes doing different thing. And then we can look at it and say, yep, your eyes are doing this or doing that. And then you can actually see it. But the other test that Dr. Schmo does in terms of the diagnostic testing, it's called Saccadometry. So this test is similar, meaning it's an eye movement test, but this test looks at the system in a different way. So this test is a test of one pathway or one circuit on two different sides. So there's a certain type of eye movement, like the fast eye movement called a saccade, that this test evaluates. But what it does is it tests this one eye movement multiple times with a large sample size, and very specifically and very sensitively to actually look at how how the system or how the pathway is functioning. For reference, this is what a normal test of the Saccadometer looks like. So what you'll do for this test is you'll sit there, you put this thing on your nose, and there's laser dots that come out. And what you'll do is you'll jump from one dot to the other, looking back and forth 100 times, 50 left, 50 right. When we download it, this is what the graph should look like. So each one of those lines is one eye movement. Each green line is when your eyes, both eyes, move to the right. And it's testing more of the left brain, if you will. And each red line is when both eyes move to the left, testing more of your right brain. So what's nice about this is you can see there's multiple green lines and there's multiple red lines, meaning there should be 50 reds and 50 greens. So you can look at the system and say two important things. The first of which being, is the right side the same as the left side? Is there an imbalance there? Are they different, or are they, for the most part, pretty similar? But the second part you want to look at is how consistent the eye movement is, meaning if I asked you to do something 50 times, or if I asked your brain to do something 50 times, you should pretty much get the same result 50 times. It shouldn't be random, or it shouldn't be chaos, or just too much variability in that system. So what I'm going to do is I'm going to show you a few examples of Dr. Schmo's patients and what they actually look like when they come in. So one sort of possible brain pattern that you see is something like this, where this graph does look very similar to the first one, meaning it's very consistent. The red and green lines are basically doing the same thing, but you can see that there's something that happens right in the middle where it sort of dips on both sides. So this person's brain did something that they're not supposed to do. It's almost like an error signal. Their brain turned something on when it wasn't supposed to, and it caused that dip. You can see that it's on both sides, which tells Dr. Schmo something in terms of what the brain's doing or what it's not doing. And what's nice about it is you can see it clear as day. It's like, yep, it happens every single time. Pretty much out of 100 times, it pretty much does it every single time. So you can say for certainty, it's like, yep, your brain's working this way every single time. And if it's normal, it's great. But if it's abnormal, you can look at that and say, hey, it's not just chance. Your brain's doing that all the time. A different example, of what another patient came in with was this. So this graph is more indicative of what's really common, meaning if you just look at the green lines, they're all spread out, like there's no consistency there. If you look at the red lines, same kind of thing, like they're very spread out, but it's just all variable, meaning like there's just no consistency. Sometimes like when they move their eyes, they like landed really short. Like if you look at the bottom of the graph, it's in the like position in terms of like where the eyes actually land, 4 degrees, 12 degrees, so on and so forth. And on this person, it's just random, you know, like there's no consistency, there's no control over the system. And that's indicative of a certain kind of, again, brain pattern or just dysfunction in the brain where it's not able to do that. But again, you can say that with good certainty. It's not like, oh, they just messed up once or twice. It's like, man, the whole time they were all over the place, which is important when you're looking at just evaluating the brain and what it does or what it doesn't do. The last example I'm going to show you is something like this. So this is more of what it looks like when one side's imbalanced relative to the other side. Meaning if you just look at the green ones or you just look at the red ones, they're fairly consistent, meaning like the red ones do similar things each time. So like out of 50 times, like the red ones always did what they're doing, which is overshooting. If you see the red ones, how on the very end, how they kind of curl back, that's called overshooting. Where if you look at the green ones, they're relatively undershooting a little bit, but it's consistent. This graph is more indicative of an imbalance where like the left side is just different than the right side. And that means something different than what the first two graphs showed. Next, what I want to do is I want to show you a real life example of someone that Dr. Schmo saw just this past week. So this person came in with headaches, dizziness, you know, symptoms like that, fatigue, and they did this test and this is what it looked like. So the first thing of note is it does look sort of not very consistent, like there's too much like, you know, like variety there. But the important thing about this test is this person, when they were doing it, they only got about halfway through the test. Then they had to stop because their symptoms increased. So we just stopped the test. But it's important, meaning if their whole system was just overwhelmed or overloaded at just 40 or 50 eye movements, that's indicative of that system is not very stable. So along with the other tests, Dr. Schmo came up with a good plan for them. Like we did treatment throughout the whole week, and their post, meaning at the end of the week, this is what that same test, what the same eye movement looked like. So I'm gonna scroll back and forth a couple times, but if you look at day 1 versus at the end of the week, you can see that it looks a lot different. The main thing to note here is that was, again, 40, 50 eye movements there. That's the full 100. So at the end of the week, they were able to do the whole test without symptoms, and they were able to actually generate the full 100. If you're just looking at like stability or just how the system's able to function, that's a good improvement. What's important though here is you can see at the end of the week what improved, but what's also still off a little bit. So you can see here that even though it's a lot better, there's still an imbalance where like the red ones are still different than the green ones. And that's when Dr. Schmo will give people home exercises saying, hey, that's way better, but this is what I still want you to work on, or this is what's going to fully stabilize that. Most people have something like this, you know, like this kind of change, like this pathway or this part of your brain is very sensitive in terms of it can change relatively fast, even like within a couple days. It's important to note though, we usually don't sit there and then just do this type of eye movement over and over. Meaning I look at it like, what are the chances that this person just got really skilled or really good at moving their eyes back and forth? We don't do this in terms of treatment this, you know, like during the week typically. We do other things, and then we use this as a pure evaluation of if this looks better, it's more indicative of their brain processing better or their brain functioning better versus they just got skilled and they move their eyes better. So it's good because you can see something like this and it's objective, meaning it's not opinion. It's not like Dr. Schmo looks at it or looks at you and says, well, you look better. You can see the difference. And it's like, even though people know that they feel better and their symptoms are lower and things like that, it's an unbiased objective test of the brain's functioning better, which is good. So that's why Dr. Schmo likes this test. He uses it as his intake and his like post, you know, treatment kind of evaluation, post testing, but it's very, very good. Even though it only tests one pathway or one part of your brain, it's very good because it tests a large sample size, so you can get a good idea of if it's truly off or if it's not, if it's consistently off, or if it's just, one or two off. But it's also very good, and it's very easy to see like if one side's different than the other. So like we use this a lot. Typically we'll do it at the start of the week, end of the week, sometimes like we do it more, but it's a very good test. So moving on to therapies and treatment. The best way to talk about what Dr. Schmo likes to do in terms of treatment and therapy at your time at the FNC, there's two broad categories of just therapies. One category is just in terms of like what you do, like what equipment or what therapies you'll actually do. But the second part is why doing the therapies here is different from doing therapies or similar treatment somewhere else. So talking about the first one, probably the easiest way to break it down is there's three main systems, and this is oversimplifying a little bit, but there's three main systems that can be targeted for brain therapy or brain rehab. One of them being vision or like visual therapy, one of them being more proprioceptive or like muscle and joint therapies, and the third one being inner ear therapies, like vestibular activity, things like that. So Dr. Schmo offers all three types of therapies. It's not like the clinic only does one, like we're only gonna, do vision therapy, or like we're a like inner ear place. It's like we do all of them because typically people need a combination, or, even though like they might need more of one than the other, they typically do well, or they respond the best when they get a combination of all of it versus just one. So like when it comes to testing and things like that, really what the evaluation that Dr. Schmo does is he'll look at it and say, which of those systems is the most abnormal, or which one's the most off or not functioning well or weak or fatigable, meaning which system needs the most training. And then what's nice is the different therapies that we do, they can isolate each system, meaning like we can isolate just the vision, or we can isolate just the inner ear, we can like isolate just proprioceptive therapies. But along with that, we can also do therapies that do both at the same time, or that incorporate vision and inner ear therapy, or like vision and proprioception and things like that. That's the key of having the right equipment, because you can be a lot more dynamic, or you can really train the whole brain or reprogram it, having different stimuli or just different activities or experiences that if you didn't have the equipment, it wouldn't be possible. The second large category, just in terms of treatment, is why it's different when Dr. Schmo does it per se versus how it might be different at a different clinic. And like there's different ways to do things. It's not like really one's better than the other. But what Dr. Schmo likes to do, and what he thinks works better for people, and at least what he has good success with, is the therapy is usually passive, which I'll talk about, which is important, but it's also really specific. So Dr. Schmo is really good at looking at all the testing, sitting with you, doing his, like bedside exam, and looking at the intricacies of the system and knowing this is what you have to do. And not just like, oh, it's inner ear, or it's, or it's visual or something, but knowing like really specifically, like it's visual in this scenario only when you're turning to the right and looking really close. And then he can come up with a treatment plan really specific to that, versus if it's just a general visual activity where you're just looking close and far away, or moving or not moving or something like that. So he can look at it and then know like the ins and outs of the system and say, this is what you really need, or this is what we have to work on in this way. And that's all built upon the testing that he does. If it's more, general testing, it's like, oh yeah, it's dizziness, so we're just going to do some, inner ear stuff all over the place. Like the chances of it working are relatively lower than if it's really biased, or it's really specific to what's weak or what's fatigable. And Dr. Schmo is really, really good at picking that out, or making sure that all the tests show like a certain pattern. So it's like, yep, this is what it is. This is what we want to do. I would say that the other part that makes Dr. Schmo's treatment different is it's usually passive, meaning people come in, like especially brain injuries, like things like that. neck issues, headaches, dizziness, brain fog, fatigue, constant symptoms, constant, headaches, constant brain fog, dizziness, lightheadedness, things like that. What happens is a lot of people will read different books or talk to different people, and they'll read or hear the brain's able to heal itself. And that's true, but only under certain conditions. So most people will think, okay, like I'm dizzy, and a doctor evaluated my inner ear, and it's a right-sided weakness. So for therapy, what typically people are given is they'll be given inner ear treatment, but it's active, meaning they'll have the patient sit there and then move their own head, or sit there and then like have them follow something moving their head, meaning it's actively done, like they're coordinating their own system. The reason that the brain's not able to heal typically early in that scenario is if the brain was able to heal from that, people would never have any issues healing from, brain injuries or any kind of, brain symptoms, because they would be able to just walk down the street, move around a little bit, or just stand up and sit down and exercise, and then their brain would heal. What happens is, though, especially initially, but even sometimes for a good chunk, it has to be passive, meaning like you can't be the one doing the treatment. It's the difference of you moving your own head versus somebody else moving your head for you. It seems, like relatively trivial, but it makes a world of difference between actually fixing something and then just learning to compensate or trying to habituate something and make something go away. It's the difference between fixing something and just trying to mask it or just trying to like learn to deal with it. So Dr. Schmo knows when it's like, this has to be done passively. Like, I want the person sitting there and not doing anything, or lying there and not doing anything, and we're going to do this, this, and this to make that system heal. And there's certain other ways to, I think some of the other videos talk about it, but Dr. Schmo likes the intensive model, where it's very frequent, very like ongoing, meaning very like repetitive. It's not every once in a while, very frequent, along with being passive and then very specific and done in a certain way that evolves over time. That gives people the best chance of healing. And like typically speaking, people like do like respond well to that kind of therapy. The jackpot, like what I call it, is when you're able to go through a certain therapy and see changes not only in your symptoms. Like if you start out with, constant dizziness, and then you leave and you're like, my dizziness is only, 10% of the day. And you can combine that with testing, like especially objective testing. That's not someone's opinion. But if you see changes diagnostically in testing that says, yep, your brain's healthier or it's more functional, and you get changes in your symptoms, that's when it's like, yep, like you're doing the right thing, like you're on the right road. Even if your symptoms aren't gone, you're on the road, or you're on the process of healing it. You're doing the right thing. Just keep going. So in some ways, just as a summary, it's not only what you do in terms of what you can offer in terms of the equipment or just different types of therapies, visual, vestibular, like proprioceptive, but it's also how you do them. It's not something that, all like vestibular therapy is the same, or all visual therapy is the same. There's a lot of just small details or small tweaks or just small ways that you can change it up that makes a world of difference. And, like just in terms of changing the symptoms and things like that. So Dr. Schmo is really good at making sure that all of those come up in line, and we give people the best probability of getting better and then healing from their brain injury or healing their, brain symptoms. So hopefully this was helpful. If you guys have questions in terms of anything I said, or just, questions in general, there should be a link to Dr. Schmo's website below. Feel free, and there, like there's emails, phone numbers on the website. Feel free to call in. We would love to talk to you and hopefully help you heal and like reduce your symptoms. Thanks for watching.